Good afternoon, everyone. Today I'm going to tell you the details of developmental supportive practices.
So first thing, why child development, developmental disorder. Second thing, when you start the developmental supportive practices. Then lastly, how will you give the developmental supportive practice? So if we see the etiology of neurodevelopmental dysfunction, only 20% part is due to genetic causes. Other are socio-cultural, environmental, psychological, and some perinatal factor, as Dr. Sandeep already highlighted. So this 80% part, or we can say the etiology, which cover these, we can prevent by giving the proper socio-cultural environment to the baby and by giving the proper perinatal care to the baby, we can prevent the 80% of neurodevelopmental disorder. Only 20% are not in our hand, which is because of some of the hereditary or genetic disorders. So we see whenever during the early age, child is having some psychological trauma or not having the proper environment or supportive family environment, then child can develop the various structural or neurochemical changes in the brain, and ultimately it will decrease the regulatory influence in the prefrontal cortex, amygdala, and hippocampus. So these structures are very important for the normal neurodevelopment of a child. So why developmental supportive practice is important? Whenever we are giving proper time to the baby, at least minimum 2 hours duration, family members should spend with the child in the form of play or in the form of communication with the child. So it will build a strong relationship with your child for a whole life. Also, brain will grow normally and your child will become smart and happy. And definitely, child will be ready to go to school because maximum neurodevelopmental disorder will start in the first 2 years of our life, early age. So now the second part, when to start the developmental supportive practices. Why is clear now? During the pregnancy, mother should start the developmental supportive practice for the fetus. It is evident that fetus can hear before birth and recognize the voice of the person who is closest to the them. अभिमन्यु की स्टोरी तो सबको पता ही है. तो ड्यूरिंग द फीटल टाइम, जिसको हम गर्भ संस्कार भी बोलते हैं, this should be started during pregnancy. So mother should talk to the fetus. मदर को अपने बच्चे से बात करनी है जब वो उसके मुंह में है, और किस तरीके के पॉजिटिव. इसीलिए कहते हैं कि गीता और भी कई अच्छी बुक्स प्रेगनेंसी के समय पढ़नी चाहिए. So developmental supportive practices should be started before birth. Then definitely when the child is small, even before child is able to speak, mother should spare the time with the child, interact with the child in the form of play and communications. And child speech, before having the proper speech, child understand. इसीलिए यदि गुजराती फैमिली का बच्चा होगा तो गुजराती अपने आप सीख जाएगा, उसको सिखाने की जरूरत नहीं है. और वेस्टर्न कंट्री में वो इंग्लिश अच्छे से सीख जाएगा, उसको सिखाने की जरूरत नहीं है. तो चाइल्ड अंडरस्टैंड द लैंग्वेज बिफोर चाइल्ड इज एबल टू स्पीक. Now how to give? When to give is clear now, then how to give. So in the play activity, in less than 3 months age, during this era where the nuclear families are more, not having the joint family and both parents are working. और जब घर पे आया बहन है बच्चे को संभालने के लिए, है ना, 8 और 10 आवर्स जब दोनों पेरेंट बाहर काम कर रहे हैं, उस समय पे these play activity and communication activity who will do? कौन करेगा यदि घर में फैमिली मेंबर ही नहीं है तो? So that's why these guidelines from the IMNCI suggested according to the age group how to spend a minimum 2 hours ऐसे तो throughout the day. जब भी मदर इवन छोटे बच्चा है लेस देन 6 months है, इवन ड्यूरिंग गिविंग द breastfeeding, मदर शुड टच द बेबी, मदर शुड टॉक टू द बेबी. भले वो समझ रहा है पर बोल नहीं सकता, बट बेबी अंडरस्टैंड राइट फ्रॉम द फीटल लाइफ. So in the form of play activity, what can we do for the less than 3 months old baby? Mother should see the baby, hear, feel, and baby should move freely and touch the baby. And also colorful object, especially the red color object, should be shown to the baby in the form of ball, ribbon in less than 3 months age group. And in communication activity, mother should look into the baby's eye. At the 1 month of age, baby can give the face regard. Eye to eye contact करके baby can interact and respond to the mother. So this should be started in early age of the life, and mother should talk to the baby, smile, laugh, and conversation should go on. Similarly, here in this image, during the breastfeeding, mother should touch the baby in a comfortable way and speak to the child. Similar activity between the 3 to 6 months, but as the child grows, more colorful object should be shown to the baby, and also the some homemade, example, safe wooden spoon or some homemade toys can be given to the baby between 3 to 6 months. यहाँ पे बहुत महंगे महंगे बाजार से खरीदे हुए हजारों के टॉयज खाने की जरूरत नहीं है. Baby will enjoy the color and texture. तो उसको टेक्सचर के लिए आप डिफरेंट टेक्सचर जो उसके लिए सेफ है वो होल्ड करे, उसको फील करे, वो आपको दे रहे हैं, और साथ में डिफरेंट कलर्स. And similarly, in the communication activities, now child can smile and laugh, and conversation should be there, and talk softly to the infant and respond. Between 6 to 12 months, this image is showing the peekaboo. Just hide the face behind the curtain or anything and show it. Child enjoy this type of play activity between the 6 to 12 months of age. Similarly, bye-bye at the 9 months of age, baby can do. So these play activity and communication activity, bisyllable words from the 9 months of age, and child understand the 2 words and make the sentence of 2 words by the 1 year of age. So in language also, as the child grows in play activity, it will be advanced and communication activity. So the main purpose of showing these slides are we should educate the relatives that and parents that minimum 2 hours daily they should spend with the child and play with them and give them the normal development. Child should not be scolded for the normal developmental milestones. Some of the milestones are like that parents think that they are doing by intention. पेरेंट्स को ऐसा लगता है कि हमें जोर करके बच्चा ऐसा कर रहा है और हमें चिढ़ा रहा है. सिमिलरली जैसे कास्टिंग है, व्हाट इज द मीनिंग ऑफ कास्टिंग पिक्चर? इट इज अ नॉर्मल डेवलपमेंटल माइलस्टोन. कास्टिंग इज थ्रोइंग एवरीथिंग. घर में उसको जो भी दिखेगा उसे उठा करके फेंकेगा. वो इंटेंशनली नहीं कर रहा है. इट इज अ पार्ट ऑफ नॉर्मल डेवलपमेंटल माइलस्टोन बिटवीन 1 to 2 years of age. By throwing the object, child understand what is the gravity, what is the sound of that object when throwing. So child enjoy these activities. उन छोटी छोटी एक्टिविटीज के लिए बच्चों को डांटना नहीं. और similarly mouthing between less than 1 year age group babies generally keep everything in mouth. उसके सामने यदि कीड़ा या चिपकली भी पड़ी होगी वो उसको भी उठा कर मुंह में डाल. I had seen the baby. So mouthing is a normal developmental milestone. We should give them the proper and hygienic toys ताकि वो मुंह में डाले. ठीक है, baby will enjoy also. So these are the normal milestones. Similarly, child also tries to do the things out. आप यदि एक्सरसाइज कर रहे हो तो बेबी भी वैसे ही करेगा. मदर यदि घर क्लीन कर रही है तो बेबी भी उठा करके घर क्लीन करने लगेगा. So these activities are the normal and should not be scolded for these normal developmental milestones. So this is from my side for the developmental supportive practices.